Good day, everyone. Today, we will briefly present our projects on Sustainable Development Goal 3, which focuses on good health and well-being. Before that, these are our group members. SDG3 aims to ensure healthy life for people of all ages, and healthcare efficiency plays a very important role in achieving these goals. Although progress has been made, many healthcare systems still face problems such as long waiting times, inefficient processes, high costs, and patient dissatisfaction. These issues can delay treatments and also reduce the quality of care, especially in developing countries. The object of these projects is to improve the quality and efficiency of healthcare service while supporting sustainable healthcare systems that align with SDG 3. To achieve this, the Six Sigma DMAIC methodologies is applied. First, define the healthcare problems. Second, measures current performance. Third, analyze the root causes, then improve the processes. And finally, control, ensure that improvements are sustained. Through this approach, healthcare service can become more efficient, reduce errors and waste, and also improve patient certifications. Overall, this project supports better healthcare outcomes and contributes to the achievement of SDG 3. That's all for me, and I will hand over to Isa to continue from here. Thank you.
First, let me explain our SMART goals. Our specific goal is to enhance students' mental well-being by addressing stress, burnout, and overall life satisfaction. In terms of measurable outcomes, we aim to reduce stress-related absenteeism by up to 50%, while also improving students' mental health and well-being scores through surveys and evaluations. This goal is achievable because we will implement targeted programs and coping strategies by utilizing existing university resources such as workshop, counseling service, and peer support initiatives. Our project is highly relevant as it aligns with Sustainable Development Goal 3, which focuses on good health and mental well-being, while directly improving students' good quality of life and academic performance. Finally, our plan is time-bound. All interventions, monitoring, and evaluation will be completed within 90 days, ensuring timely and effective outcome. Next, I will briefly explain our team roles and responsibilities. Our project lead, Alwin Kit Kwanjing, oversees the entire project execution by guiding daily activities, managing the team, and ensuring all tasks follow the project timeline. I, Noriza Akila, serve as the survey coordinator responsible for designing and conducting surveys, analyzing data, and ensuring the accuracy and integrity of the result. Emilia Famsinro, our program coordinator, plans and organizes mental health workshops and awareness programs to increase student engagement and understanding. Chong Pong Hoon acts as the student liaison, communicating directly with students, gathering feedback, and supporting both academic and personal development. Lastly, Cheong Hui Fen is our evaluation officer who monitors stress-related absenteeism and evaluates the effectiveness of interventions to ensure project goals are met and potential issues are addressed promptly.
This project identified the increasing level of student stress, burnout, and stress-related absenteeism in higher education. From the define and measure phases, the main cause were academic workload imbalance, insufficient sleep, and limited access to counseling service. Using a CTQ3, student well-being was translated into measurable indicators such as sleep hour, stress score, counseling utilization, and absenteeism rate. These findings show that student mental health is a systemic issue that requires a data-driven Six Sigma approach aligned with SDG3. From a societal perspective, high stress reduces student quality of life and academic engagement. Vulnerable students are more likely to be affected, which reduces inclusivity on campus. By improving key CTQ indicators such as absenteeism and well-being score, this project helps create a more supportive and inclusive learning environment for students. From an economic perspective, poor student mental health lead to delayed graduation and cost repetition, which increases institutional costs. This project improves student retention and on-time graduation by addressing mental health issues early. As a result, university can reduce operational costs while producing a healthier and more productive graduation.
Hi everyone, my name is Alvin Kek Chuan Sing and I will be presenting about the project Impact Evaluation Sustainability. So, this project focuses on long-term sustainability rather than short-term solutions. Short-term mental health initiatives are often ineffective because they do not provide continuous supports. Our project addresses this by embedding ongoing mental health monitorings. By using a data-driven Six Sigma approach, we can track the trends, reduce risk, and continuously improve the outcomes. So, the key of the CTQs for the sustainabilities are long-term stress levels and sleep trends, which allow to measure lasting impacts and ensure the projects remains effective over time. Next, I will be presenting about the health and safety. Stress and sleep deprivation significantly increase both mental and physical health risks. These projects aim to improve psychological and physical well-being, helping students manage stress more effectively and maintain healthier sleep patterns. So, by doing so, it supports a safer learning environment where students are more focused, alert, and resilient. The CTQ here include an increase in sleep durations and a reduction in high-stress cases, which indicate improved health and safety outcomes. And the last, legal and environment. From a legal perspective, universities have a duty of care to protect students' well-being. This project supports that responsibility while ensuring ethical and confidential data handling. Environmentally, the use of digital surveys reduce paper usage and resources waste. The CTQs includes policy compliance and a higher digital process adoption rate, showing that the project aligns with legal standards and environmental sustainability. That's all for me. Thank you.
Right. So let's move on to the summary. The core problem of our project will be the reporting of 60 to 70% of uni students are facing high stress and 25 to 35% of them face burning out. So this will be a great impact to the academic, which means the absenteeism for the uni student per semester due to stress usually will be 3 to 5 days, according to our data. So the main goal of our project is to reduce the stress absenteeism to 50% in 90 days. Our methodology using the Apply DM AIC to make our issue more visualized and solve it with effectively. So the tools we're using are CTQ trees and also the SIPOC diagram. This will help us to visualize the root causes and also the input and output of the issue. So let's move on to conclusion. I have concluded four main objective that why we need to have this project. The first one is to abstract to measurable. So when we use the Six Sigma tools, we can turn something very abstract that can't imagine to something measurable, and we can solve the problem. So for the second one will be the societal foundation. As we know that nowadays the youngsters and the youth generation are the main key for our society to become success. So their mental health should be focused and also to be fixed first. So the third one will be the protecting the vulnerable. So as we know that the youngsters and the young generation nowadays are not mature enough, and then we are doing this research to focus on their needs and also give them the useful help and aids for their mentally stable and also physically stable. So the last one will be the scalable model. So when we talk about the Six Sigma, we can use the DMAIC more effectively to apply it on the complex human challenges. So which means we can use DMAIC to convert the complex human challenges to something we can solve it very easily. So that's all from me. So thank you.